right. Good afternoon. We're going to start this afternoon's media briefing on the report of the Auditor General called Better Healthcare for Albertans. For the benefits of those online, we'll be taking a few remarks from the Auditor General, last about 15 minutes or so. Then we will open up to questions, at which time the Auditor General, Merwan Sahar, and his team will be happy to answer questions. For the benefit of those on the line as well, we're going to do questions here, and then we'll go to the line. We'll alternate back and forth until we've answered everybody's questions. For the benefit of the people in the room, because we are web streaming this event, we're going to be using microphones. So we'll be passing a mic to you for you to answer a question so the audio can be picked up online. So with that, Alberta's Auditor General, Merwan Sahar, has some remarks for you.
Thank you, Kim. Good afternoon, everyone. With me today on my right is Doug Wiley, Assistant Auditor General, who had oversight of this project, and on my left, Sergey Peck, who was the engagement lead on this project. Just before I start, I want to just show you the documents that we're discussing today. Our report, Better Healthcare for Albertans, is in fact in two parts. There's the main report, and there is a supplementary additional report that we have entitled Research Material. The main report is in great measure supported by the research material we have in this second report. The second report, I think, is possibly unique. I don't think anyone has ever done what we did, which was to put together essentially a history of healthcare in Alberta, tracing it way back and explaining how the system works, who's involved in it. So let me just leave it at that. We also have done something which we hope Albertans will find useful. We've prepared a short at-a-glance document which really summarizes the key points of this particular project. My comments today will be longer than usual. The topic is of great importance to Albertans, and you haven't had much time to read our report. Since the 1990s, the Office of the Auditor General has done over 40 audits on aspects of the Alberta health system, including seniors care, mental health and addictions, primary care, and chronic disease management. The Department of Health and Alberta Health Services have implemented many of our recommendations for improvement and are working towards implementing others. Alberta Health Services has also undertaken significant initiatives to improve quality of care. But as of today, 41 recommendations remain outstanding in the health sector, 19 of which have been outstanding for more than 3 years. Through all of our audits over the years, we've observed an unfortunate pattern. While Alberta Health and Alberta Health Services report progress on some of the recommendations from year to year, in our follow-up audits, we very often have to repeat recommendations. Weaknesses noted in our findings keep emerging and re-emerging over time because their root causes have not been or are not being, have not been or are not being resolved. Today we are presenting a report, Better Healthcare for Albertans, to the Legislative Assembly and to Albertans, in which we identify opportunities based on models from other jurisdictions to take the entire health system to a higher level, to make a quantum leap rather than continuing to make incremental change, reorganizing, or moving in circles. This report is not an audit in the traditional sense, but a report aimed at identifying and overcoming the barriers that exist in the current system as a whole that are preventing Alberta Health and Alberta Health Services from being able to effectively act on our recommendations, which in turn is preventing Albertans from having the quality health care they are entitled to expect and deserve in exchange for their funding. We have deliberately broadened the audience for this report to include all MLAs, healthcare providers, and Albertans as individuals. We did this to make the point that government cannot by itself move this province to fully integrated healthcare. Integrated healthcare is a proven model. Let me begin by saying we support the stated government policy direction to have a fully integrated healthcare system. Our audit recommendations over the years all point to an integrated healthcare framework. And integrated healthcare has been the government's goal since the 1990s. Integrated care is a system of care built around the patient, not on administrative needs. It is a framework used by the highest performing health systems in the world. Barriers to progress. Integrated care has been a policy direction in Alberta since the 1990s, but it has not been achieved for three main reasons. Those reasons are the fragmented structure of the health system, the lack of integration of physician services and the services of other care providers, the lack of sharing and use of clinical information. These challenges affect the entire health system. As a result, Albertans are not receiving the quality of care they could receive. The formation of Alberta Health Services is a step in the right direction towards creating an integrated care framework. And I want to make it really clear, our report should not be construed by anyone as suggesting that AHS should be dismantled. 3 areas for improvement. Alberta is well positioned to lead the country in creating a high-performing healthcare system focused on quality of care for the patient. More money is not the solution. The key building blocks are in place, but there are 3 elements that must be better incorporated into the framework of the health system if Alberta is truly to achieve integrated care. First, structural changes are necessary within the system itself. By structure, we mean the relationship between the Department of Health, Alberta Health Services, and members of the medical profession. In an improved structure, evidence-based care would become central to decision-making. Funding would be linked strongly to results, meaning best possible quality of care. Accountability for results would become part of normal, accepted process. All MLAs and cabinet ministers would respect operational boundaries and not make specific demands of the health system, often intervening in matters that are the responsibility of healthcare managers. And patients would have access to the tools to be engaged and empowered to take an active and responsible role in their own care, including personal healthcare information and treatment options, to be able to communicate effectively with their care team. Currently, Alberta's public health care does not operate as one system. It is like an orchestra without a conductor, a collection of independently acting providers and professional groups that offer treatment through a series of isolated episodes, each within their own scope of practice. It's the legacy of a model organized around episodic hospital-based care, not centered on preventive care in the community. Physicians work independently with little connection to other healthcare providers. No part of the system is clearly responsible for coordinating the care of individual Albertans as they move from one provider to another. The healthcare system is not designed to manage the cost of care for individual Albertans over time. The system has evolved around accountabilities for isolated program budgets. No part of the system is clearly accountable for the overall care outcome for individuals or groups of patients. The health system has not evolved to help providers form lifelong relationships with patients. While most providers would argue that they are accountable for the care they provide, it is as if their accountability stops when the patient walks out the door. Consequently, there is a lack of accountability to Albertans who fund the system for the combined results of healthcare delivery. I'll say one last thing on structure before I move on, and that is that healthcare delivery in Alberta has been shaped over the last several decades by the funding needs and negotiating efforts of healthcare providers, the administrative needs of the health bureaucracy, and frequently shifting priorities of the 4-year political cycle. Second, there must be better integration of physicians within the system. Modern medicine is moving toward team-based care, and more coordination across specialities and care settings. Expectations for quality and monitoring would be set by physicians themselves, not by administrators or government officials. Physicians as a group would take part in assessments of the effectiveness of their care in the context of continuous improvement. Financial incentives for physicians would encourage more attention to health results in a redesigned system. Physician payment models would promote and encourage accountability for quality of care. They currently do not. Payment models would also encourage closer integration of physician services with those of other healthcare providers. Changing the pay model does not require having the money come from a different source. It does mean finding ways to pay based on results rather than on the volume of services performed. Contrast what's needed with the state of physician integration today. That's what I'm going to do, contrast it. The government, on behalf of Albertans, spends over $4.6 billion annually on physician services and support programs. However, physician impact on cost is much broader than the fees they charge. They direct patients' use of services across the healthcare system through hospital admissions, lab tests, diagnostic images, prescriptions, etc. Yet their relationship with AHS is not sufficiently integrated. There is a limited connection between AHS and primary care physicians who work independently of AHS. The lack of integration between primary care and AHS is a fundamental challenge because there is universal consensus that effective primary care is the foundation of a high-performing healthcare system. I'm going to repeat that. It's so important. There is a universal consensus that effective primary care is the foundation of a high-performing healthcare system. An effective primary care system treats patient diseases early, improving health and reducing the need for expensive hospitalization. For example, timely intervention and appropriate treatment by a family physician in primary care can prevent higher-cost emergency visits or hospital admissions in AHS facilities, particularly for patients with one or more chronic diseases. Alberta's healthcare system is not optimizing the effectiveness of primary care in reducing patient use of emergency and acute care services. Turning to compensation. The way physicians are compensated in Alberta is not aligned with integration of frontline service delivery. The majority of the province's physicians are compensated through fee-for-service, a model in which physicians are paid for each service they provide to a patient. Fee-for-service pays physicians for the volume and complexity of services they provide, but doesn't consider the quality of those services and their impact on total healthcare costs. The Department of Health does not set clear expectations for the money it spends on physician services. The current compensation model provides little incentive for physicians to provide continuity of care to patients. As a result, most physicians do not monitor a patient's health status between visits or proactively contact patients to remind them when tests, procedures, or medication reviews are due. Other service providers are able to offer such services. Car dealerships routinely notify customers when their vehicle is due for an oil change. A vet will remind pet owners that their family pet is due for a vaccination. Yet Albertans seldom receive the same level of service from our healthcare system. Finally, physician oversight. Alberta does not have a framework to oversee and manage key aspects of care quality achieved by publicly funded physician services. Oversight of physician services is currently fragmented between the department, AHS, and the College of Physicians and Surgeons of Alberta. Each monitors some aspects of the inputs and outputs of physician services, but none assess the care outcomes achieved for patients over time. The third barrier to moving forward, which must be improved, is if we are to have a successful integrated care system in Alberta, is around clinical information systems. Ensuring that the right information is provided to the right people in the right place and at the right time is crucial to integrating healthcare services. Alberta Health Services has done a good job of managing administrative information. Improving the use and sharing of health information between the various healthcare providers and organizations has proceeded more slowly. Sharing of patient records with all relevant staff and with the patients themselves is necessary for everyone to play an effective role in care. That means information generated at all levels must be seamlessly available for use at all levels. Patients, physicians, care teams, care programs, and executive management. Full and rapid access to information acts as a crucial tool for physicians and other professionals at the point of care. It helps providers make better treatment decisions through electronic support tools that provide recommendations for treatment and warnings about potential harm. It also helps managers know what programs and treatment approaches work best. Alberta has the opportunity to lead the country in this area, as more key elements of a full information system are in place here than in any other province. Action is required now. Through our analysis, we have determined the root causes and impediments to progress and offered solutions and action items based on concrete examples from other jurisdictions with some of the highest quality of healthcare in the world. What we now need is for all people in the system, from the minister, the government, and all MLAs, to the healthcare providers and professionals, and individual Albertans, to act immediately if we are going to make a difference in the lives of Albertans. Real change would see them all taking specific action. We owe it to ourselves, the next and future generations, to not make do as we have done. The government must provide leadership to make integrating care a priority and hold others in the system accountable for results around the quality of care and the health of Albertans. Government administrators should not be making care decisions on individual Albertans. Their role is to ensure the experts they have entrusted to provide that care are held accountable for the quality of care they are providing. All members of the Legislative Assembly must think and make decisions for the long term, not from the perspectives of short-term politics, election cycles, isolated controversies, and lobbying of local interests. Healthcare providers and medical professionals must change how they work, break down the silos, integrate services, and align data and funding flows around the care needs of patients. But perhaps the biggest change needed is for individual Albertans to get more involved. To succeed, we need to update the mindset of every citizen in Alberta to be an active participant in the system. Individual Albertans must take a more active role and interest in managing every aspect of their health and their health care. It is the government's role to ensure they have the tools they need to do it effectively and to focus on the quality of their care. I've reached the conclusion. Alberta has a chance to build on what has been shown to work best. Our province is well positioned to lead the country, provided we all change our approach and preconceptions about the healthcare system. Alberta has some of the best healthcare professionals in the world, but the strength of the healthcare system does not rely solely on the competence of its healthcare providers. It depends on their ability to work together to manage quality results and cost of care for their patients. Nothing in this report is a new thought to healthcare professionals. It is an attempt by us to use our skills as auditors to help the government better deal with our recommendations over the years, all of which point to integrated healthcare. By identifying and better understanding the root causes to what is impeding the system from achieving fully integrated care, we can move towards it more rapidly and more effectively. We present this report as an encouragement and guide for all the participants in the health system, on how they must work together if we are to ever succeed in achieving integrated and best quality healthcare for Albertans. I urge everyone to read our report entitled Better Healthcare for Albertans, and every Albertan to act on it. Based on our work, I want to leave no doubt in the minds of Albertans that improvements in our healthcare system are not only necessary and overdue, but improvement is entirely achievable. You are paying for the best. Why would you not demand the best? Thank you. So we're ready to take your questions. I think it would be very helpful if you would just introduce yourself and the organization you're with before you give us your question. Thank you.
And just a reminder as well, please use the microphone because we are streaming the audio. First question from Tom.
Tom Vernon, Global News, Edmonton. Moving to this integrated system, you say the building blocks are in place. Realistically, if the government says tonight, okay, let's do it, like how quickly could this be done? Is this a many years project, or is this something that can be turned around relatively quickly?
I'm not a healthcare manager. It's not something that I can tell you with evidence. How long would it take for us to achieve a fully integrated healthcare system? It's not something that will be achieved overnight, I know that. It's not something that can probably be achieved in one election cycle. I also know that. The answer to your question is for the government as the participant in all of this to create, if you will, an action plan, to bring everyone who has different responsibility but has to play a part in achieving integrated healthcare, to produce an action plan which says, for example, we will achieve integrated healthcare in this province by such and such a date, and these are the actions that we will take to achieve it. There have been umpteen strategies over the years. In our report, in the section on structure, we have a little table which shows innumerable, I'll try that again, a lot of strategies over time which started, got going, and then, if you will, failed, in the sense that they faded away. And there are reasons for why that happens. It happens because of the churn, of the change, the fragmentation, if you will, of the structures that we work within. But back to your question, how long will this take? The answer will lie in a well thought out action plan which says, this is what we want to achieve, and we are going to achieve it by this date. And that would be, if you will, it's a transformation project. In my opinion, it should be managed as a project. The length of the project will determine on the effort that goes into putting the project plan together.
And then secondly, the results-based payment structure for physicians, what does that look like? Is it if their patients are getting better, or is it going down well-researched, well-evidenced treatment strategies regardless of how the patient responds? I guess that's what I'm curious about.
When we talk about results, we're talking about, the result wanted is the best possible quality of care. That's what it is that we believe physicians should be held accountable for. And so you may say to me, what is quality? What does that mean? I expected a question, perhaps, what does better healthcare mean? What does better mean? Better means higher quality. Higher quality healthcare is evidenced by things such as tailored care plans for individuals that are actively managed, the safe handover of an Albertan as a patient from one provider to another, disease prevention, proactive engagement with patients, continuity of care. That's the key to quality, is continuity of care. Interdisciplinary teams, evidence-based good practices. The power of information today, physicians, skilled physicians. I happen to know that the most skilled physicians do not rely on their accumulated knowledge and wisdom. They use the information tools that are available to them to help them in their decision making. These are called evidence-based good practices. Condition-specific care pathways. Physicians today practice medicine if they're treating you for a chronic disease. They have or can have available to them, for example, the right sequence of steps to take, who should be doing what at what time. The obligation, in my opinion, on physicians is to contribute to these systems, so these systems get ever better, because physicians are contributing to their learnings so that care quality improves over time. So when I talk about results, it's results in terms of promoting and achieving the best possible quality of care. We think physicians should be involved in measuring that themselves. The whole purpose in any system of performance measurement is to learn. It's not to punish. That's a difficult thing, I think, for people to get used to, the idea that you measure performance to learn so you get better. Performance is not measured so that you can be punished.
Hi, Keith Jorian from Post Media. When the government reads this, my guess is they're going to say, yes, of course, we know about integrated care. As you said, it's been policy since the 1990s. And I think they're going to say we've taken some steps. We have a physician resource plan that will hopefully integrate AHS and the primary care system more. We have a new governance model for PCNs. We have a new funding model for PCNs that's coming. A clinical information system, some money's been put into that. What's your assessment of those steps that have been taken so far by this current government? What's your assessment of how far they go to achieving what the model you've set out here?
Okay. I don't criticize any of those initiatives. I would characterize them as being, if you will, piecemeal initiatives, in their own right important and evidence of trying to move forward. My criticism would be that each of these initiatives is, as I would put it, piecemeal. I haven't seen any one of these initiatives included in an action plan that clearly is designed to achieve integrated healthcare by a certain date. From my point of view as an auditor looking in at a system and its chances of being successful, one of the things we're trained to look for, if you will, is initiatives that are not demonstrably connected. So I don't criticize any one of those initiatives as an individual initiative, but I would argue that by themselves they're piecemeal until they can be shown to be part of a well thought out plan to achieve integrated healthcare, that those initiatives in and of themselves are well connected and designed to achieve the end goal. Then I would say that the government has not done everything that it needs to do.
Okay, and just second question is on, I wonder if you can talk a little bit more about the role of politicians here. You mentioned they need to kind of divorce themselves a little bit from some of the day-to-day interventions that they're asking for. I wonder how you see that playing out both with the minister and the government MLAs as well as the opposition MLAs.
I don't know how it will play out.
How should it play out?
I can tell you how we believe in our analysis of the situation. What are some of the deep-seated structural problems? What would have to change if we stand a good chance in this province of achieving fully integrated healthcare? And we've set those out. For those of you who have access to the Better Healthcare at a glance, they conveniently are on the last page. The things that each of the participants in the system who need to work together but each have particular responsibilities. I mean, clearly we say the responsibility, in that analogy of the orchestra and conductor, clearly the conductor, in my opinion, is the Minister of Health. But I can tell you that no Minister of Health can do this by themselves. That's why we set out these four parties who have distinct, unique, important roles. The government, members of the Legislative Assembly, healthcare providers, and Albertans themselves. And perhaps that's the biggest change. Albertans themselves, I don't think have ever really seen themselves as an active participant in their healthcare system. Albertans tend to see themselves as, well, when I need some care, I know I can go and get really good care. And then they judge the system by that measure. You know, I needed my appendix out, I got to the right place, it was taken out, and I'm good. But that's not the high quality, continuous care that we're talking about here. Episodic care like that is good, but that's not what high quality healthcare is all about. Back to all MLAs. They need to think long term. In my opinion, they need to think about the health care of their constituents in the long term. They need to be thinking about what does high quality health care, what does that look like? That's what they should be engaged in, trying to promote that. Not, if you will, using healthcare as an opportunity in the short-term political electoral cycles to score points.
Okay, let's take a couple of calls from the line. Operator, can you announce the first caller, please? And a reminder, give us your name and your organization before you ask the question.
There are no questions on the phones at this time.
Anyone else in the room?
Can you talk also a little bit more about the relationship between Alberta Health Services and the Department of Health? There's been some talk, of course, that there's too much duplication of services. What is the right structure for those two entities?
It's not for me to prescribe how that should be. I can, and this report tells Albertans how it is. And Keith, I would draw your attention to the piece in the report which, it's really the piece on structure. It's section 3, current structure of public health care in Alberta. It makes an important point through a diagram which shows that primary care and family physicians, this is on page 21, are separated from Alberta Health Services. That's a fragmentation which would have to be examined and justified. From our point of view, it points to fragmentation which is holding up fully integrated healthcare in this province. Carrying on through that, we have a diagram which essentially says that there is a parallel. It's almost as if there's parallel management of the health system. Alberta Health Services is the service delivery agent in this province. But for every area in Alberta Health Services, we can find a parallel area in the Department of Health. And from a rational business point of view, that doesn't make sense. So I think that that relationship needs to be examined. It's what leads to confusion, confused accountabilities. I'll ask Sergey, who really knows this stuff inside out. Sergey, in your words, just describe the relationship, please, between Alberta Health Services and the department, and from a fact point of view, what would be the indicators that something should change?
Well, the nature relationship between the department and AHS is deeply rooted in history. Back when there were 256 hospital boards in Alberta, the department had a key central role in coordinating those services and carrying a number of operational programs. As the health authorities, as we now moved down from 256 to 17 health authorities, then to 9, now we have one single health authority. The role of the department became less clear. The system has evolved, the role of the department hasn't. So what we have now, as we did our audits on seniors care, infection prevention control, mental health services, what we see is that for every operational area within AHS, a department has a parallel structure, and no major decision can be taken in operations without departments' implicit or explicit involvement and approval. So this was one of the symptoms, just one of the symptoms of this problem.
So sorry if I'm oversimplifying this then, when I look at this and listen to what I'm hearing. Does integration mean more centralization? Maybe Alberta Health Services takes a greater role with physicians and how primary care looks and how primary care works? Or do we still want to keep this as kind of two distinct sides to the health system?
So, I mean, I think you've hit on something, which is essentially the healthcare budget is sort of fragmented into two pieces. There's the funds allocated to Alberta Health Services, and then there's the Department of Health and its payment to physicians. I mean, it's as if there are two parallel budgets. The answer is to think of this as at the center of the healthcare system. A high-performing healthcare system is the patient. Everything should center on the patient. So the systems that we see are the ones that have built up over time. They're not designed to deliver continuity of care. They're not designed to ensure that information flows well. So I don't have a prescription. All I can say is that the best performing integrated healthcare systems in the world put the patient at the center, and then they work from that. In my opening comments, I repeated that the best performing healthcare systems are centered on primary healthcare. Anyone looking in at these diagrams and charts would say, if primary healthcare is supposed to be at the center of the system, how can it be so divorced from Alberta Health Services? There's something that needs to be examined, proven to make sense, or changed. Sergey?
One thing that we clearly saw when we looked at successful healthcare provider organization elsewhere in the world and in North America, what we observed that they all succeeded by going about in very similar ways, by integrating their care. There's some fundamental principles that they've all followed. And it wasn't really a question of centralization or decentralization. If you will, integration, it's local initiative and frontline expertise being supported centrally. Central function identifies the best practices, evaluates them, deploys them provincially or across the entire system, and funds their implementation. So it's not about decentralize or how many organizations do we need to have. The very premise of integration, when you're funding services based on quality they achieve, that incentive for identifying population needs and being locally responsive is already built into the model. Integration, by default almost, is locally sensitive model of delivery of care.
Okay, last call for those on the phones. Any questions for the panel?
There are no questions on the phone at this time.
Thank you, operator. Anyone else in the room? All right, thanks for joining us this afternoon. We'll be posting information on the web stream after the fact. We'll be posting a video later in the week. And if you have any questions or follow-ups, contact communications. Thank you.